Hey YouTube, like and subscribe. I'm going to show you what's in a dental hygienist's drawer for toothpaste and things that I use at home. This drawer not only has things I use, but it has things my children use. So my top things for me, there's a whole bunch of used little tubes of Sensodyne because I do have sensitive teeth. You can see they're some very used. I use Sensodyne pretty much exclusively, but you can use any brand that has potassium nitrate for sensitive for teeth. I did at one point buy Sensitive. It's a tooth powder, so it doesn't have all the chemicals and additives like sodium lauryl sulfate in it. It doesn't have fluoride. This tooth powder made my teeth really sensitive, so it did not work for me. Otherwise, it was a pretty good product for cleaning. I did actually buy an orange version for the children because they do not like mint and they do not have sensitive teeth. This is a very good powder. You actually have to wet your toothbrush and then dip your toothbrush in the powder. There's no foaming agent, so it's a little bit weird to brush with, but you get used to it pretty quick. The other toothpaste that I had bought in the past was David's. This was a whitening one. I wouldn't buy this one again because it has carrageenan in it, which is a seaweed algae that is not good for the digestive tract or consumption. I wouldn't get it again. It was okay. The other one was Boca, which was another natural toothpaste. The kids didn't mind the flavor. It did a pretty good job. I don't really have any complaints of it. I think it's on the don't get list anymore. The one that I did buy for the kids now that is in paste form is also Living Well with Dr. Michelle. She is a natural dentist, I think out of Utah. This had good taste, good consistency. Kids didn't complain. Pretty decent ingredients. Doesn't have any of the junk that we're trying to avoid. Again, no foaming, so you have to get used to not having a mouthful of foam. But I think this is a really good buy, even though it is a little bit pricey. It's on sale right now, and I'm probably going to buy it. I think it's buy 3, get 1 free, so about a year's bunch of toothpaste. We have MI paste, which I used to use a lot. I thought it was pretty good. My oldest one ended up with a few cavities, so I don't use this exclusively anymore. And then my go-to floss, which is actually very hard to find, is the Reach Cool Mint. It actually has to be this flavor or it shreds in the mouth. This one is from work. It's a sample one. It's really thin. I only use this if I get the other floss stuck and I can't get it out, so this is not my go-to, but if you have really tight teeth, this is okay. The other go-to, which is the secret and I tell all patients to use, are these itty-bitty little proxy brushes. These are Pixters. They work great. They're something that you only use a few times. That one's got stuff on it. They're great for getting into spaces. You just kind of bend it to get in the back teeth. But you can use it a few times if you wipe it off and clean these little bristle brushes. But eventually, it's going to break right at that filament head. So you have to make sure it doesn't break off and you swallow it, because that would be a very dangerous situation, which would probably be an emergency surgery or whatnot. It's kind of like swallowing the bristle brush from a grill, which can perforate your colon and stuff. But these are really great. They also have interdental brushes. This was an amazing product. They discontinued it. I don't know, maybe it's poisonous or toxic, but this worked really great for sensitivity. And this was one that I was supposed to use on patients, but we stopped using it at work and I brought it home, and I've been savoring the last little bits of it for when my teeth get really sensitive. So this is a great product, but they don't make it anymore. Lastly would be little gum go-betweens. These are not as good as proxy brushes because they don't clean as much, but if you got big stuff like a piece of meat or something stuck between your teeth, this would work. So you can see there's kind of a whole lot of mess. This is another toothpaste that kind of got pushed to the back. Used to use it, still okay, don't use it very often now. But those are kind of the hot mess that you would call a dental hygienist's drawer at home. Thanks for watching. Like and subscribe, and leave any comments in the video. Thanks.